Pregnancy can come with a whole host of symptoms. Headaches, back pain, and nausea are the usual ones we hear about when we think of pregnancy. But what about those symptoms that are a little, well, strange? Some symptoms can be a little shocking, like a change in your shoe size to downright wild, like having a dream of giving birth to aliens or wanting to chew rubber. Join us today as we explore some of the craziest symptoms pregnancy has caused. Let's get into it. Having a superhuman sense of smell. Yes, it's true, even if it sounds exaggerated. Still, some women are shocked to notice the sudden sensitivity of their sense of smell. Getting whiffs of odors from the most common items may make you feel nauseated, even if it's something you usually like the smell of. If you experience this, try keeping a small handkerchief handy with drops of your favorite perfume for sniffing. And it's good to distract your nose from all the bad smells. Don't worry, this item doesn't typically last long as it disappears by the first trimester. You start tasting metal. It sounds weird, but during pregnancy, hormones like estrogen and progesterone increase, and it can lead to changes in taste for many women. This condition is called dysgeusia, and it makes you feel like you're chewing some old pennies with your lunch. As you could imagine or already know, it's not a good feeling. Still, you can eliminate the metallic flavor from your meals by having sugarless gum, eating spicier foods, and drinking colder liquids. On the topic of taste, you might want to chew rubber or chalk. Many of you must have heard of this silly symptom. Unusual cravings during pregnancy are normal, and they're called pica. Anemia or mineral and nutritional deficiencies are usually the cause. To curb the strange need to chew on dangerous materials, discuss with your nutritionist for advice to constrain these cravings. You might need supplements. Moving ahead, you can have a false period. Many pregnant women face implantation bleeding, meaning you'll slightly bleed or notice spotting in the early days of your pregnancy. This light bleeding can happen when the fertilized eggs attach to the uterine lining. It's normal about 2 weeks after conception. Other causes include ectopic pregnancy, cervical irritation, or threatened miscarriage. In these cases, make sure you get medical help as soon as possible if your light bleeding gets heavier and you start feeling extreme cramps, back pain, or stabbing pains. Next is brain fog, but like for real. Another one of many strange pregnancy symptoms is you start forgetting things. It's also known as pregnancy brain, but is it real? Many studies have concluded that pregnant women experience cognitive decline during and after pregnancy. You might forget the song you played an hour ago or be constantly distracted and have trouble focusing as you're used to. It can happen due to hormonal changes. You can even have interruptions in your regular sleep cycle. You'll notice stretch marks. Although not the strangest symptom, it is a common one. Almost 8 out of 10 women get stretch marks during pregnancy. Stretch marks are narrow, streak lines that develop on the skin's surface. They can be in different colors like pink, red, or brown, depending on the color of your skin. Stretch marks are normal, but if you're trying to prevent any, check out Trilastin Maternity Stretch Mark Prevention Cream. The perfect pregnancy lotion for every mom's skincare routine. It reduces the visibility of scars during and after pregnancy. This cream contains natural plant-based extracts and shea butter, making it safe for you and your baby. Apply daily on stretch-prone areas to see results. Check out the link in the description below, and don't forget to add it to your pregnancy essentials. Expect mood swings like no other. Were you laughing at a joke a moment ago and suddenly started weeping? Pregnancy mood swings can make your emotions go from 0 to 10 quickly. This is usually due to a surge of hormones, but generally improves as pregnancy progresses. Still, in rare cases, pre- or post-pregnancy depression can happen due to hormonal sensitivity and your history of depression. If you're vulnerable and struggle with your mental health, try to find ways to de-stress or talk to a mental health specialist. Your teeth may start to wobble. I know, as silly as it sounds, but your teeth may want to move around a little bit. Many years ago, it was common for women to lose teeth during pregnancy. With time, developed nutrition and dental care mean this is not so evident. Still, hormonal changes increase the acidity in the mouth, leading to an increase in cavities. Ligaments and bones in the mouth can relax during pregnancy, so teeth may start to wobble, but with proper care, they should stick and hopefully not fall out. You'll want to pee all day. Staying hydrated while pregnant is important, but your growing uterus will put pressure on your bladder, making you have to run to the washroom more often. Having to pee all the time is expected early in pregnancy, although it may decrease a little into the second trimester. Still, closer to the end of pregnancy, as the baby prepares for labor and delivery, more pressure will be added to the bladder, causing you to urinate more. Nosebleeds and bleeding gums. You are more fragile than ever during pregnancy, leading you to experience nosebleeds and bleeding or swollen gums. Believe it or not, this is also a normal part of pregnancy. Having a baby is not easy at all. Your body's blood volume increases dramatically when you're pregnant, and enhanced blood flow to more sensitive tissues such as nasal membranes and gums may cause bleeding, but don't worry, it'll pass. Pregnancy slows down your digestion, leaving you feeling constipated. You may feel bloated as if you want to pass gas or go number 2 more often, but you'll find yourself not being able to. Hormonal changes during pregnancy and perinatal vitamins can lead to constipation. Your digestive system functions slowly during pregnancy to allow the nutrients from the food enough time to absorb into your bloodstream and reach your baby. If you can go, try adding more fiber to your diet and drink plenty of fluids. You can also exercise regularly. If you're still unable to go, ask your doctor about a pregnancy-safe stool softener. Your shoe size changes. Yeah, you heard it right. Feet swell during pregnancy, and there's a loosening or relaxation of the ligaments throughout your whole body. You may face some foot pain, and your shoe size might change, which can be permanently different after the baby. Having swollen feet during pregnancy is caused by your body carrying extra water weight, and the pressure of a growing womb causes issues with proper blood flow to your legs and feet. To reduce the chance of swollen feet, try to avoid standing for long and prop your feet up when sitting or relaxing. Swimming and exercise can help a great deal as well. Heartburn is common. You may have never had digestion issues before, but for many women, pregnancy can be an introduction to it. Various hormonal changes can cause heartburn and acid reflux. Also, the growing baby starts exerting pressure on your digestive system. Fluid or food in your stomach will reflux upwards into your gullet as you lay down or sleep. Avoid late-night meals, snacks, and drinks before bedtime to keep your digestive system in check. And you could also develop spider veins. Spider veins are thin red lines that appear on the skin that resemble a web. During pregnancy, these can appear on your face, arms, legs, feet, and chest. Because your body produces more blood to support your baby's growth, that extra force to push blood back to your heart causes spider veins. Typically, these veins will shrink after birth and within 3 to 4 months may completely disappear. Spider veins are harmless and usually don't cause pain or issues during pregnancy. Sometimes you'll experience some vivid and wild pregnancy dreams. Strange and upsetting dreams are a completely normal part of a pregnancy. While pregnant, your body gives up a lot of control, creating tension about your future and approaching motherhood. These anxieties, added with the fatigue, can lead to many restless nights filled with weird dreams. It's common for pregnant women to have dreams like horrible car accidents, falling from planes, or giving birth to aliens. Giving birth is not an easy task. During pregnancy, you might encounter any of these symptoms. Luckily, these are not harmful and all pass with time. Want to keep learning about different health symptoms? Watch 14 hidden signs your body's trying to tell you something. Or 8 things your nails can tell you about your health. Click one, or why not both, to keep the conversation going. Shall we? What are the weirdest symptoms you've faced? Let us know in the comments below.